Hello, everyone. My name is Mary Angela Saavedra. I'm the director of the Center on the Hill, and I am so pleased to be joined today by Geraldine Kohut, who is joining us from Cathedral Village to talk about telemedicine. I don't know about you, but I have definitely been concerned about my health and not going to the doctor as much due to the pandemic. And now we've all switched to this telemedicine, and it is a little bit challenging to navigate sometimes, but it's actually really great once you get into it and start doing it. So I'm very pleased to have her tell us a little bit more about it. Thanks so much for being with us today.
Hi, Mary Angelo. Thank you so much for inviting me and for this talk that I'm going to do today on telemedicine, telehealth, virtual services. A little bit about my background. I am a registered nurse with a master's degree in education. I work for Cathedral Village as their community liaison. And I'm sure so many of you, when you see this, will recognize my face. Hopefully you will, and a smile, hopefully, because I've done many programs at Center on the Hill, and you are delightful. Mary Angelo is delightful, and she has not skipped a beat. I mean, I really have to tell you this, Mary Angelo. You are one of the managers you are one of the only managers that has done so much for your participants. I mean, the lunches are wonderful, everything that you've been doing. So she has not forgotten you, even though we can't all get together. So I wanted to share that with you all. Again, we're going to do telemedicine and telehealth virtual services. And I must say, this is such an important part of our medicine today because of COVID-19. Doctors do not want you to come to their office unless it's absolutely necessary. So this actually covers that. You can do it at home, sitting with your phone or your computer, and see your doctor, and if it is necessary, they will then set up an office visit. So it is wonderful, especially during this time of challenges with the COVID-19. Telehealth, which is a broad word using telecommunications, virtual tours, all of the different things. It's under an umbrella titled telehealth. But it does involve a broad range of technologies and services provided for patient care and improved healthcare delivery. This also includes non-clinical training, administrative meetings, and continuing medical education. And I can tell you that I have been on these meetings, and they are just wonderful. You can do it, you can join from your office, or a group of you can join, and it just makes communication so easy and so important for medicine and healthcare today. The World Health Organization also uses telehealth for their surveillance, health promotion, and public health functions. So telehealth is something that is about 10 years old, but it is increasingly becoming so much more important today. Telemedicine, which I will focus on throughout the program, this allows healthcare professionals to evaluate, diagnose, and treat patients at a distance. You're not at the doctor's office. Using telemedication communication technology is the answer for so many different topics that can be handled over the phone or over the computer. The telemedicine evolution was initiated over about the last 10 years, but it has become such an increasing important part of the healthcare infrastructure. Doctors love it. Patients, once you do it, love it. It's easy, and it's so helpful to make sure that you are seen by your physician or nurse practitioner when you need to be seen. The history of telemedicine, it actually started in the mid-50s with basic criteria. I mean, so basic. Doctors from a nearby hospital system or medical center needed to share information and or images. The first successful sharing occurred in our state, Pennsylvania, and they shared x-rays and they were transmitted over the phone. Now it sounds really basic, but we're talking about the mid-1950s. And when this happened, it was just absolutely phenomenal. In the early days, it connected doctors working with a patient in one location to a specialist somewhere else. This was so critical in rural areas where specialists were not readily available. I lived during my nursing career and with my husband moving all over the place. We lived in Tennessee and we lived in Kentucky. When you talk about rural, you know, it is Tennessee and it is Kentucky. And it made it so easy for these physicians to making sure that that specialist got the information they needed and they could do it remotely. It still was a challenge, and the equipment was not very, it was very complex and it was very expensive, but they were the early days, and we have had many changes since then. What happened? The rise of the internet. The internet age brought profound changes for the practice of telemedicine. I mean, profound. The access to smart devices capable of high quality video transmission added to the surge. Just about everybody has a smartphone, and you could do the same thing on your smartphone with a visit to your physician as you can with the computer, which we certainly will talk about. It delivers remote health care to patients in their homes, workplaces, assisted living facilities as an alternative to person visits. Now, here is the benefit of telemedicine that the patients enjoy. Well, it's less time away from work. Pick up that computer on your phone. You can just do it in the office if you need to, or you can do it at home. There is no travel time, no transportation required, including wear and tear on your car, the gas to get you there, and parking expenses. Now, I mentioned that I graduated from Thomas Jefferson University in the day, and now going to Jefferson Hospital, and my doctors are there. $30 is just about the average going rate for parking. So I just think telemedicine is absolutely so helpful for the patients. Less interference with child or elder care needs. It is private. It is private. If you're in your house and you have a computer or your cell phone, you can close the door, you can relax, you can have a beverage while you're waiting for the actual telemedicine view to come on. So it's really wonderful. But the most important part, and hear this everybody, there is no exposure to potential contagious patients at medical office. I know oftentimes you go to the doctor's office and you try to find a chair that's not near anybody. And you see people coughing, sneezing, they look sick, and they are sick, and that's why they're there. But it really is just not the best environment for you, especially if you're not feeling well. So there is no exposure to any potential contagions. And also some of the doctor's office, with the absolute number of people that they see, they're always not as clean as they should be, because somebody comes in, somebody else sits in the same seat. Their magazines, do you really want to pick up a magazine that somebody has been coughing on beforehand? So all of these things are positive benefits for the patient who is using any type of telemedicine or telehealth service. Here is the benefits of telemedicine the providers enjoy. So your doctors or nurse practitioners, they can increase their revenue because they can see more patients if they are organized. It improves office efficiency. All of your stuff is there right away. If your doctor needs to have something sent out of the office or your lab test, he just sends them right to you. An answer to the competition. Guess what? There are so many retail health clinics open and online providers. So doctors and nurse practitioners and your caregivers really want to nip it in the bud so that they are your first step if you're not feeling well. Better patient follow-through and improved outcomes. Well, if you know you don't have to drive into your doctor's office, you don't have to pay $30 to park, you don't really have to get dressed up. You could just stay in your PJs if you want, or your sweatpants. It makes it so nice for patients, and you feel better about it. Also, they actually have to determine that there are few missed appointments or cancellations. Well, what can you do? You can't say your car couldn't start because you just don't want to go to the doctor's. And also there is private payer reimbursement, which is a good thing to know. And Medicare and Medicaid will pay for the payment. Now, how do you actually apply telemedicine? Well, it's great for follow-up visits. It's wonderful for chronic disease management. Let's say you have a pulmonary problem and you have to have oxygen. Well, it's really a challenge to get to the doctor's office with that little portable tank that you have to use. And with this chronic disease management, people are really staying healthier because they see that person, let's say, or they talk to that person, let's say every 3 months, and they get the management that they need. If they have a problem, they can just click in to their doctor. Remote post-hospitalization care, wonderful, wonderful. Let's say you go in and you've had surgery and the doctor says, I really want to see you in a month, but I want you to do this telemedicine so that I could talk to you in 2 weeks. This way I'll make sure everything's going well, you have no issues or concerns, but I probably will see you in the office in 4 weeks, but you get that post-hospitalization that is so important. Preventive care support is absolutely wonderful with it. You know that you're feeling good. If you're not feeling good, you can get that support 24 hours a day. And that's important to mention. Telemedicine is 24-hour service. And one of the most important things, and we'll talk about this as we proceed, one of the most important things, you have to be connected to your physician or nurse practitioner. You can't just click on and assume that you're going to get a service. If they haven't seen you before, they really cannot apply telemedicine. But also, if you live in an assisted living center, what happens on 3 o'clock in the morning when you just have a really bad stomach ache and you call the nurse sees you, and then she is able to call your physician at 3, because that physician will have someone covering for that person, for them, and all of a sudden, you don't have to go to the emergency room because that doctor is saying, let's try ABC. No fever, that's good. Pain is moderate, it's not severe. Let's just wait. Temperature, vital signs taken, and we'll touch base maybe at 8 o'clock so that you don't have to go to the emergency room. It alleviates that. Virtual check-ins we'll talk about, and e-visits, which is an email to your physician. The summary of Medicare telemedicine check-ins. Telemedicine visits with provider that uses a telecommunication system is between provider and patient. Again, you have to have seen that patient before and you know them. This is not somebody that is just wanting a doctor. You can do that in a different avenue, not through telemedicine. A virtual check-in, this is wonderful. It's just a brief check-in of 5 to 10 minutes with your provider via telephone or other communication systems to decide if an office visit is needed. That's what that virtual check-in. You're not sure, you call the office, you talk to the nurse, and she just tries to figure out what is your real concern. Is it something that we could try to handle over the phone? E-visit, communication between provider and patient via an online portal with a question. So let's say you need a prescription order, you need a refill. Well, sometimes that refill, you need a new refill, you need a new prescription. You just do an e-visit, call the doctor, email the doctor, and they'll be able to send that new prescription directly to your pharmacy. So there are so many things that can be done and making your life and also the life of your provider easier and more organized. Reimbursement. Well, what do you have to pay for? Private payers do reimburse same amount for telemedicine as if service was provided in person. Medicare and Medicaid do reimburse for chronic care management, which is wonderful. But effective March 6th of 2020, COVID-19 Medicare telehealth services are furnished to patients in a broader spectrum of relationship and check-in, which means because of the COVID-19 infection, they do not want you to come to their office. They want to keep you safe and they want to keep their patients that have to be seen safe. So effective March 6th, there was a discussion that Medicare will cover these services because of COVID-19 without question. Okay, so application of telemedicine. Follow-up visits more efficient and patients more likely to keep appointment, therefore more successful outcome. If you're starting to feel better with a follow-up and you say, well, do I really have to go? I don't want to travel, I don't want to go in, I don't want to get dressed. But yes, you can have follow-up visits via telemedicine. Patients with chronic disease are more apt to maintain good control of their disease. Why? They have that portable oxygen that they have to take it to the office, go up an elevator with the oxygen, and it's just not convenient, and it's hard on that person because they have a chronic disease to begin with, and they, are not in the best situation for travel. So that's wonderful with chronic disease. Post-hospital care, success and reduction of readmission. So you go into the hospital, you have surgery, and instead of having to go, sometimes people, they want to see you in 3 days or 5 days, you can just click on telemedicine, doctor will see you, talk to you, any complaints, any problems, anything you want to tell me. And again, this is private, it's between you and your doctor. Preventive care and support is positive for patients. Here we go with the assisted living residents. They can connect, especially after hours, to determine if ER or hospitalization is needed. Again, they're going through their doctor, and they'll say, okay, let me talk to you. Don't go to the emergency room. I think what you have is still what we saw you were originally for. Continue to take your medication, monitor your vital signs, temperature, pulse, and respiration, and let's see how you're doing. But if anything changes, we'll make a decision, and we will certainly see you in the office if needed be. What is a virtual check-in? Okay, it's generally initiated or requested by the patient. So you call the doctor's office, and I'm a nurse, so I always ask to speak to a nurse if I have a question about an appointment, because the scheduler, when you call, will say, well, the doctor can see you in 3 weeks. Well, you don't want to wait 3 weeks. All you want to do is ask a question. So that's a virtual check-in. So you requested by the patient. You have to be established or an existing relationship with the practitioner. The doctor or practitioner needs to educate patient about the check-in. Because next time you go to the doctor, say, do you do a virtual check-in? And if they say yes, and we'll say, well, that's great. Call me anytime. Talk to the nurse. She'll get that doctor. Or if not, she will make sure that you at least get an email back and forth to the doctor. It avoids a trip to the doctor's office. Now, Medicare coinsurance and deductible would generally apply to this service. And we'll talk about that a little bit later, because I want you to be sure of your specific insurance that you are covered. Virtual check-in, again, can be as limited to a 5 to 10 minute conversation. You're talking to that nurse, you're telling them what's the problem, or to the doctor. They'll be on the call also, but it's just 5 to 10 minutes. This discussion, can determine any next steps, office visit or other service. So this is just saying, and you're not really feeling well, do you have a fever? What are your complaints? What are your symptoms? And they'll be able to at least alleviate any tension or stress that you may have about your symptoms and say, yes, we can do this. We'll talk to you about it. And if it's not any better, then call us back and we'll do probably a telemedicine visit. An online portal can also be used if the practitioner uses this tool similar to sending a message or email to provider using the same virtual check-in guideline. So again, this is perfect for emails to your provider. Most physicians do have a portal these days because they know it is safe, it's easy, and it is HIPAA regulated. Well, HIPAA regulation. HIPAA is the Health Insurance Portability and Accountability Act, called HIPAA. Healthcare providers have this discretion to use other tools to serve patients in good faith during a pandemic of COVID-19. It can use everyday communication technologies for patients, such as you can use FaceTime, Skype, or an online portal. So what HIPAA is saying, because of these, with any pandemic, but especially COVID-19, because it is so infectious and you can get it by droplets, coughing, or sneezing. So that's when you go to the doctor's office, oftentimes that's what people are doing, coughing, sneezing, or droplets communicated to you. So these communications are very, very important. And you can use anything. Remember, we have a way of using telemedicine, which is a little bit more secure, but they're saying for these times, we can use FaceTime, Skype, and online portal. So that makes it a little bit easier. Is telemedicine safe? When used under correct conditions and for appropriate cases, telemedicine has proven to be safe. But every situation is different and all are not conducive to treatment via a telehealth visit. Provider needs to use good judgment when this delivery is appropriate or office visit is needed. So the important thing is you have to realize that all of these things that we're talking about, certainly sometimes the doctor or practitioner will say, I really need to see you in the office, and that is what happens. How do you set it up? Well, now I have to share something with you. Mary Angela, you can laugh a little bit, but I have never had a telemedicine visit. And about a month ago, I had canceled my March appointment because COVID had just started. And I called the doctor and I said, I'm fine. I just really think it's the right thing to do. And so she agreed. I only go once a year, so it was no big thing. So she canceled it. And then I started to, I think it was mental, but I didn't feel well for about a couple of weeks and some things were changing. And I thought I should really find out if I need to talk to the doctor. So I called the office and I went to the nurse, not the scheduler. And she said, well, you know what? I think with what you're saying that we need to see you. And I said, well, would I be seeing my doctor? And she said, well, I'm going to set that up. That's what we're going to try to do. I said, okay, whatever is best, I'll do anything because I wasn't feeling good. And I did not want to go to the office. So she said, well, we'll set you up for this telemedicine. So I think, oh, this is really fun. I could do it. Mary Angela, I could do it. And I did it. The first step was to get an app on your phone. And it was funny because I had to first I go to Jefferson Hospital. I had to get that app. So I got that app and oh, I was just proud, shaking my hands. I'm saying I'm doing this. And then I had to just answer a couple of questions. So I thought, well, this is it. I had the app of Thomas Jefferson on my phone and I thought I am brilliant. Well, that's not how it turned out because the second step I had to do, I got actually an app from my doctor. And this was another part of the setup, which was called, at Jefferson, we call them My Chart, but everybody has a different portal. So I had to set that up. Well, I did, and I succeeded. But by the time I was going to talk to the doctor, I was a nervous wreck. So if they were taking my blood pressure, it would be 1,000 degrees. But believe me when I tell you, it is easy to do. And I'm sharing this with you because it is easy. So how do you set it up? The doctor, the doctor will determine what method is appropriate for your virtual visit. It could just be a call to the nurse. So that's what I'm saying. You really have to be honest. Why do you need to see the doctor? So it could just be that little virtual visit where you have 5 to 10 minutes and you're going to try to solve this problem. They will provide you necessary requirements to proceed. They're going to talk about billing. Some doctors will have you sign a form, a virtual form that you just pencil in, or they'll send you something and you could just approve. So billing information is important. And for any type of a virtual program, you really should contact your provider. If it's Blue Cross and Blue Shield, Medicare, Medicare Part B, just make sure that they cover it. And from my knowledge, they do cover most of these programs that I'm talking about. But most specifically, because of COVID-19, Medicare and Medicaid services do cover these services. But again, if it was me, I would check with the billing information to make sure everything is covered. Some people will send a consent form for treatment if applicable. Most often when you're going to the same doctor, you've already signed a form. But anyway, they might need something that is sent to the office. They will ask you, do you have computer access or a digital phone or a home phone? Which is best for you to use? They may request your height and weight, temperature, and blood pressure. And I'm sure in this day, we can all get weight on that scale, even though you may not like it. Take your temperature. And most people do have a blood pressure cuff around somewhere. But if you don't, just say, I don't have it. But be prepared. Make sure you have the phone number if you become disconnected or if you're on an extended wait time. And that is what happened to me. They say to appear 15 minutes before, which I did. And you could see the little app saying My Chart, but no doctor. So I waited 15, then I waited 20, and then I waited 30 minutes. So I thought to myself, I did something wrong. I had to do something wrong. So then I thought, well, let's give it a little bit more time. So then it was 40 minutes. Always have your provider's telephone number with you so that you're not ruffling through papers or anything. I called and the nurse said, "Oh, didn't she pick up, or isn't she on your call?" I said, "No." "Well, she will be there in 5 minutes. She's taking care of another patient." Well, at least I knew I was okay. And the doctor did come on absolutely within 5 minutes, and we started the call. So these are all things in setting up for your telemedicine call. Now you get ready for your visit. You schedule the time with the provider. Make sure you can access your provider. It says to arrive 15 minutes prior to your scheduled time. Perfect, you need to do that. But this is so important. Have a list of questions. Why are you seeing this provider? And make sure that they are addressed. So you have the list, most concern first, and then at the end, take notes. You're okay because it's just you and your provider, and they certainly will appreciate if you have to take any notes. If provider, again, has not connected with you within the 15-minute time frame, contact the office. So as I said before, have that number with you just in case. Review why you're seeing the practitioner. Make sure at the end of the visit, you review with the practitioner your laboratory requests, prescription requests, next visit or in-house visit, and next steps. So you need to make sure that this is finished, that your telemedicine was a good visit, just like your doctor's visit, and ask questions. It is just absolutely imperative to ask these questions, because if you do, you'll have a great telemedicine visit. So I just have some things that I already said in the program. First of all, make sure for telemedicine you are tech ready. If you're not, contact a family member, a good friend, and they will help you get set up. So that is so important. Remember, you're just getting set up. The person can leave. Once you're on it, there's nothing else you have to do. Check your insurance. I mentioned that. That is so, so important. You make the appointment at a time that is really good for you. Also, to make sure that you have somebody that is in the household or nearby that you can just say, if I call you, come on over. Because you want this, the first one especially, you want it to go well, and you want to complete the telemedicine. You want to get your medicine, you want to get your blood work, whatever has to be done. And when I talk about describing your symptoms, you're the only one in the office. This is so private, it's so good. So you really tell the doctor what's wrong with you and why you need some help. There is good security, and you absolutely must make sure that that happens. Check to see if your service is secure, your computer is secure. Oftentimes they will ask you to use your cell phone. I think they feel it's a little bit less cumbersome for you, but you'd have to have a really good phone. You could use anything you want. But also I say, be prepared to wait. And that's a good thing. Just think, you're waiting and sitting in front of your computer or your phone, you're in your office. You don't have to think about a trip home. So all of this is really very, very good. Again, you still may need to be seen by your physician, but that's the purpose of telemedicine. You're in your clean environment, you're more relaxed, you haven't had to travel, you haven't had to mix with people that perhaps may be carrying a disease or a germ. So this is why it is just certainly so important to be able to use telemedicine. And it is one of the things that during COVID-19, it has just catapulted. And I will tell you sincerely that I think so many of our visits will be through telemedicine. So this is not something that's going to go away. It is here to stay because it's organized, it's clean, it's neat, and you don't have to move out of your house. So are there any questions, or Mary Angela, do you have anything that you'd like to hear me talk about?
No, thank you. That was all very, very clear and really great information. My experiences with telemedicine thus far have been very similar to what you described, in the sense that I often had that sort of first consultation piece, and then it was, well, we need to see you in the office, under precautions, of course. But I felt very good about not having to wait, because in the beginning, when this was all still sort of getting worked out, there were some things that I was sort of scheduled to be followed up on in March and April, and those all got pushed way back, and that made me nervous, feeling like, well, am I just ignoring that piece of my health? So I was definitely pleased when things fell in place, and I can see now how, once you sort of navigate it and understand what it is, yeah, I think it's a great tool, and I do think you're right. I think we're going to see a lot more of that even going forward for a while, because we've realized it isn't always necessary to be in that office and be there with everybody when, a lot of our needs can be met otherwise. And, they even, sent me orders to get blood work. So then I would, just have to go into that one office and get my blood drawn and then walk out. And then the doctor, perused that information and then had a meeting with me to talk about that. So I think it's really great. Yeah, I don't, I guess I have one small question about the technology piece. So particularly for seniors who might not have a lot of technology options, some of this can be done literally through the telephone, right? We can
Correct.
have conversations and do that kind of thing.
Right, exactly. The conversations, can you hear me okay? Okay. The conversation can absolutely happen. I think that's a great thing, because being a nurse, I kind of can understand, but it's me. So I still have to talk to somebody. It's my health. And I think all of it is really good, but always check in with that nurse, because she can say, yes, we should see you, or because the issues that occur, the virtual check-ins, all of them are extremely important. But as you said, it's not seeing that doctor. But to avoid that office and to avoid so many things, there are steps. You could do a virtual check-in. They listen to you, you talk to them, and maybe the next step could be a telemedicine. So I think they build on that. So that's what's really good about it.
That's excellent. Yeah, no, thank you. This was all really wonderful information. And I know if I hadn't already traveled these waters a little bit myself, this would have been very reassuring to me to know sort of how this all works. So thank you for taking the time. If anyone else has questions for Jerry, if you want to email them to me at msaavedra@chestnuthillpres.org. That's msaavedra@chestnuthillpres.org. I'll be happy to pass them along and get those answered for you. So please feel free to reach out and let me know. Thank you so much for being with us today. I really appreciate your time and talking to us.
Oh, thank you so much. And I really appreciate everything that you've done. I can't get back. I'm so excited about getting back to Center on the Hill and seeing everybody. I'd like to give them a wave, but they can't see the wave.
I'll see you.
Okay.
I can see a wave. All right.
Okay, thank you.
Thank you.